In what is being called the first study of its kind, medical researchers have attempted to quantify the rise in opioid-related admissions and deaths at U.S. hospitals. The team studied hospital records over a 7-year period between 2009 and 2015. The results put numbers to a drug epidemic that is growing rapidly. Kevin Enox has this report.
The study charted the number of opioid-related admissions in big city intensive care units. Dr. Jennifer Stevens, one of the study authors, spoke to VOA via Skype.
These are heart-wrenching cases. They're people usually in the middle of their lives. So they have parents, they have children, they have a lot of different people in their lives who care about them. And these are patients who are coming in increasingly, we were finding, in extremis. And we wanted to know if this was really happening across the country.
It is. They found that between 2009 and 2015, those cases rose by 34%. The hospitals Stevens surveyed are all in major metropolitan areas, and she warns the number may be even higher in rural areas.
I would suspect that this epidemic, particularly in critical care, has hit the rural community hospitals or the suburban community hospitals even harder.
And that's the other part of the equation. The cost of dealing with opioid patients jumped by over 50%, from about $58,000 in 2009 to nearly $100,000 in 2015.
The substantial increase that we saw in cost is more a reflection of the severity of illness, I think, than anything else.
Stevens says her concern is that the opioid crisis is overwhelming the ability of doctors to help people.
Despite everything we can do in intensive care units, more folks are still dying of their overdoses and complications of their opioid use disorder.
Stevens and her team say the other surprise of their report is that most of the cases involved people addicted to street heroin and not prescription opioids.